Hello and welcome to another edition of the Simsbury Woman. I'm Shannon Knall. Thank you so much for joining us again. And this month I'm so pleased to be featuring something that is very close to my heart, autism awareness. And joining me for this edition of the Simsbury Woman is Lauren Amendola, who is the Connecticut Director for Autism Speaks. Lauren, thank you so much for being here.
Thanks, Shannon.
We have a lot to cover today. As many of you know, I have a child with autism, and I could talk about this all day long, but we only have a half an hour, so we'll focus on the highlights. April is Autism Awareness Month, and as a representative of Autism Speaks, you are working in Connecticut to raise awareness, raise funds for appropriate services and treatments for children with autism, but we're also focusing on a bigger awareness campaign this month called Light It Up Blue. Can you tell us a little bit about that?
Sure. Light It Up Blue started about 3 years ago through Autism Speaks nationally, and we brought it down to the local level. And we're joining, I believe, 7 continents, over 8,000 buildings going blue, national and international landmarks. And it's not just lighting a building blue or doing a blue light bulb. It's really just showing awareness in any way. Mm-hmm. That could be at school, it could be wearing blue, it could be just showing your awareness and education to others about autism.
And I'm so proud and thrilled to report that Hall has been lit blue for the month as well. This is the 3rd year in a row that we have done that, and I think it sends a really positive message to the community and those of us who are impacted by autism that it is supported and that there are people out there who are supporting us. So I'm pleased to have Simsbury on that list of 8,000 buildings across the world. So let's talk a little bit about what autism is. By definition, tell us what autism is.
Autism is a complex neurological disorder. So again, and it's a spectrum disorder, so wide varying ranges of symptoms and many things that come along with that. Mm-hmm. And obviously, as you may know from your personal experience, that one autism is different than another. And a lot of people may be misled or educated on what it is, being the type of disorder it is and how complex it is. We need to, again, educate those on it.
Mm-hmm. A couple of good points in there. Autism is a spectrum disorder. I always say just because you know one person with autism, you really only know one person with autism. It presents itself differently in different people, just like people are different. Autism is different in each person. But we're at an alarming rate of autism's occurrence in this country. Now the Centers for Disease Control report an incidence of 1 in 88 people have an autism spectrum disorder. And I can say from personal experience that when my son was diagnosed 9 years ago, we were at 1 in 250, I believe. And so now, 9 years into this journey, we're at 1 in 88 and looming on the edge of 1 in 50 children. This is a staggering statistics, and we've really reached a public health crisis. Tell us a little bit about those statistics, what they mean, and what Autism Speaks is doing to address them.
Yeah, and Shannon, you made a great point. It is a public health crisis, an epidemic, and there's a lot of talk about the numbers. What do they mean? And again, it is 1 in 88 are diagnosed with autism, 1 in 54 boys, and every 15 minutes a new diagnosis is happening. So we need to make change, and we need to make our voice heard, and Autism Speaks is using that kind of on an advocacy level, federal and state, to make that known. And I think people don't understand how the rate is increasing and what the needs are of these children and adults on the spectrum. And Autism Speaks is here to raise that awareness, but the funds, not only for research, but what are we going to do now with housing and transition, and to really help educate everyone on that. Mm-hmm. And so we are really behind that and our mission to make sure that happens.
Mm-hmm. Now, whenever I speak about autism or when I'm doing my advocacy work for autism, I focus on 5 areas. I focus on access to appropriate medical treatment, education, housing, employment, and research. For me, those are the 5 areas that in a very, very broad way are the focus. There are many, many things that come under that, but that's the direction that I really feel we need to move. So in your experience, in your journey with Autism Speaks, do you feel like we're moving in that direction? Do you feel like we're making strides?
I definitely think we are. I've been working for Autism Speaks for 3 years, and I've seen over those time that that is the topic of conversation, that it's not just children, it's adults, or our children are now becoming a tsunami, as some people have coined the term, that's going to come up into adulthood. And I believe Autism Speaks just last year has formed a housing committee at a national level to really look at housing opportunities across the country in each and local state, and also transition services. What does that mean? Is it higher education? Is it life skills? Is it living on your own? There's many different options, but helping parents and families and caregivers discover those options and really being able to give them the tools and information.
Right. And that kind of brings me back around to the statistics again, because I've heard when I talk about the statistics being 1 in 88 or whatever they are at the time, people often say, well, it's just because of better diagnosis. And that may very well be the case, but the fact remains that there are still 1 in 88 children, adults, who require services and who want to be a part of society but need the help to do that. So whatever the statistics are, the need for services really doesn't change.
I agree, and I hear the same thing. Is it more numbers because we're more aware and people are better diagnosing? And at the end of the day, it doesn't exactly matter on what maybe your thought is, the cure, the conditions and whatnot. It's really that we have these children that need that support, therapy, services, the right resources, and we need to also educate the community on all of that and take care of that child and adult first. You know, and that's really definitely our focus.
Right. There's so much to focus on, so it's important that we lay out a plan and we are able to step by step kind of address each of these issues as we go along. It's a really overwhelming thought to do that, but there are many of us, many parents on the ground and in the trenches who need that support. So I'm glad that Autism Speaks is out there doing that. Tell us a little bit about what goes on in Connecticut as far as our fundraising and awareness initiatives with our walks.
Sure. We now have 3 walks in the state of Connecticut. The greater Waterbury area, greater Hartford, and southeastern Connecticut. So beyond those walk events, our Walk Now for Autism Speaks brings a lot more. It's families being involved, it's families doing events and fundraising and awareness. It's a committee of volunteers and parents coming together. It's reaching out to local but big corporate organizations and businesses here in Connecticut that will support us on a financial level to do everything we need to do for the mission of Autism Speaks. So in June, on June 1st and 2nd, we have Greater Waterbury and Greater Hartford Walk Now for Autism Speaks, and October 19th in Waterford, Connecticut, we have Southeastern Connecticut Walk Now for Autism Speaks. So I think those events not only are having us come together for fundraising, but so much more goes into them through with events and every piece of our mission to kind of come together to help the families here in Connecticut.
And as you also probably know, I was the inaugural chair for our first walk in Hartford, 7 years ago?
8
years ago,
year.
oh my. And we started in Elizabeth Park with 2,000 people, and now we are at Rentschler Field for the Greater Hartford Walk, and we get anywhere from 8,000 to 9,000 people every year. It's a bittersweet story. It's a day for our families, but it's also a really a visual of just how many people are impacted. And now that we have 3 walks across the state, that that reality is even more present. But these are necessary from a support perspective, as I mentioned, from an advocacy perspective, because many of our state legislators and town officials come to these and participate and see the vast numbers that are impacted. But it's also important to raise this money to fund research. Can you tell us a little bit about what's going on the research front?
Sure. Since Autism Speaks formed in 2005 and a couple years later with all of our science and research grants, Autism Speaks has granted over $100 million in scientific evidence-based research. So great things are happening, and we fund research projects where the best researchers are. We also have a fellowship program, a lot happening in the Boston area, right here in Connecticut, a lot happening at Yale and University of Connecticut. So things are happening, and Autism Speaks is reaching out and searching for and awarding and granting the best scientists, the best researchers and fellows to make this evidence-based initiatives on the science front. So it's really great to see that those funds are going there, and good things are happening on that front.
And funding this kind of evidence-based research is so critical for so many reasons. There are so many theories about what is causing this autism epidemic that the evidence is really what we need to drive future movements. That I know I can speak to the advocacy perspective. Evidence-based research drives advocacy and allows us to pass legislation that is the best for our families. And it also brings others into the movement. When we have the evidence as to what is behind this epidemic, we have so much potential to change the future for our families. So I think it's so important, and it's fascinating to me that so much of this is going on in Connecticut. Dr. Deborah Fine up at UConn is kind of making her rounds around the autism community now with some great research. Right. So it's good to know that that's coming home.
Right, and it's great to know all of our hard work and efforts here in Connecticut are coming back. And it's not just Yale, the hospital, the university, the Child Study Center, but it's so many other things too. And to know, especially up at UConn, all of the great work that our hard fundraising dollars are going to come back, and those answers are going to happen. And it's great to be kind of part of that in Connecticut. And
I think that's important for people who want to contribute and want to support Autism Speaks, that money is coming back to us, and we are seeing the results of that research moving forward.
Correct.
Yeah.
Yeah, it's just beyond research too. We do community grants,
right.
different local summer camp, our Baker summer camp grants, even here in Connecticut. We've been giving grants since 2007, over $100,000 to local autism resources and communities to give back to the needs here in Connecticut.
And that's an excellent point, because while the research is so important on a broad federal level, being able to support families who are living in the here and now of autism on a day-to-day basis with valuable services and valuable treatments is so, so important. From my own personal experience, I know that it can be a very isolating experience. Upon diagnosis, resources are scarce. So it's really critical that we are able to support services locally and be able to share them within our own communities here in Connecticut. So I think that is definitely a point I want to drive home. So where can people go to find out more information about autism?
You can go to autismspeaks.org. Our website is very user-friendly. Sometimes I always hate referring people there, go to the website, but it's a very user-friendly, informational site to land on. Under our family services section, we have toolkits, which kind of range from the first 100 days of diagnosis, which we say is useful, up to the first 3 years.
Yes, absolutely.
And again, all these toolkits are free to download, save on your computer, print, or you can send away for them for free. It will be sent to you. A lot of them that you get in the mail, then they'll know by your zip code where you live. So all of your local resources will be included in that toolkit. And they range from transitional services, grandparents and family, how to kind of deal with autism, going to get your hair cut, going to the dentist.
Yes.
And we're making new ones every few months. Our family services department is doing great things. And those are really great family services and resources we have on the website, as well as under your local community. You can click where you live, what state, which community, and get a whole wide range of links and information right there for you. So it's a great website. So that's autismspeaks.org.
Great. And one thing I want to mention on that front is that last year we did do a training for our first responders, police officers here in Simsbury, to familiarize them with what autism might look like in an emergency situation. So I'm really pleased that the Simsbury Police Department has been able to, has been proactive on this front, because that is an issue that families face. If you have a fire, if you have an emergency at your home, how does your autistic child or loved one react to that? And that could cause another crisis in and of itself. So I'm pleased to say that the Simsbury Police Department has taken those steps to work on raising their own awareness about autism.
That's great. And I know on a national level, we're trying to work with police and fire academies on a national level, so it is part of their training. Autism specific information, learning the signs, knowing how to handle or deal with a child, an adult, or a family that may be affected by autism. And again, on the website, we have first responders information and toolkits to each specific type of first responder. And our Autism Safety Project really is focused around that. And I think it's important, and I kind of applaud Simsbury and other towns that are doing it to kind of jump on the board to really educate first responders and the community.
You mentioned learning the signs. Let's talk about the signs of autism. Again, keeping in mind that everyone is different. Just off the bat, a couple of things to be looking for.
No babbling or eye contact by 12 months. No speaking by 24 months. A lot of the mile marks have changed, and also Autism Speaks' mission is to be able to diagnose and educate pediatricians and the first medical field on diagnosing under 24 months, and we want to get it to 12 months. So those are a few signs. Again, it could be speaking and then loss of speaking, no speaking, the babbling, the eye contact, the avoidance of any, replying to your name, interacting with others, and social skills. And we really want to diagnose early so you get early intervention, which, people do believe, is going to help change some of those signs that we're learning about.
And in reference to learning the signs, there's a wonderful resource on the Autism Speaks website called the Video Glossary that shows typical development, toddler development, if you will, side by side with a toddler developing with autism. And if there is anyone who has concerns about their child, I would really recommend the Video Glossary as a great way of identifying differences and distinctions in development. And from that point, I would definitely encourage concerned parents or caregivers to talk to their pediatricians, because there are services that are available for people at that point.
Right.
When we're talking about the signs and early intervention, preschool teachers are on the front lines of this. Pediatricians are on the front lines of this. How do we help them have the discussion with parents that perhaps there is something different about the way their child is developing?
I think that's a great question. I think it's hard for parents to bring up the concern to a pediatrician, but sometimes maybe even a nursery school teacher to bring it to the parent. Again, Autism Speaks has a lot of resources on how to have that conversation, what is the best way to approach it, and how to do that. And I know Autism Speaks' goal is to reach all pediatricians with the education and information they need to not only know these signs, but what to ask for, what to do, and what's the next steps. But I also really ask all of kind of our local supporters and volunteers to then educate your community, be it a town or a small area where your child is going to school, going to daycare or nursery school, your doctor's offices, your health professionals, on all of the information. And we need all of our volunteers on a local level and parents and supporters to do that. So we're reaching every single person to understand all those signs and that information.
Yeah, I do remember when my son was in preschool, his preschool teacher having to have that conversation with me about how something might be different, or that he wasn't responding to peers, and he was seemingly not responding to his name and not interacting appropriately with peers in preschool. And being that he was my first child, I had no idea what might be off or what might be appropriate. So I know in retrospect that was a really difficult conversation for her to have with me, and my reaction was probably very difficult as well. But I think it's so important that parents feel that they are supported in having those conversations, and that there are resources and places for people to go for help.
Right.
So I'd like to continue to see that evolve in our communities. What else from a community perspective do you think people can be doing to support families?
I think the biggest thing is listening and understanding. So the understanding part is, if you're not in it or you're not fully educated or aware, you may not really understand how to understand or relate to a family. And it's not having to relate and be like them, it's just having to understand the differences and have acceptance. The biggest thing I hear is we just need someone there, someone to listen.
Right.
You don't necessarily have to say anything.
Right.
You just need to be there and invite the family to do every typical thing any other family would do. You know, they're just the same in a different way.
Right.
And I think it's just that accepting. You know, you don't have to necessarily relate, but you need to just be there.
That brings me to a couple of different areas, but I'll focus on families again. Autism is expensive. Many say autism is unaffordable. Many families are not covered by insurance for any diagnosis of treatment of autism. In Connecticut, we do have a law that requires coverage for the diagnosis and treatment of autism if you are privately insured. That covers about 40% of our state. So 60% of our state and our families do not have access to medical treatment. This can cost a family up to $60,000 out of pocket a year, which is troubling. The more troubling part is that families are not getting services because they are unaffordable. What are we doing to change that?
I think a lot of that goes back to the advocacy of it. You know, it's known that it's over someone's lifespan, and autism, as the numbers change, it's going to be over $35 billion for the United States to be able to fund, insure, give services to all of these families. Although autism services receive less than 5% of funding compared to other childhood disorders and diseases. So I think where that starts is on an advocacy level. And when people hear advocacy, I think sometimes maybe that word scares people.
I agree.
And I don't want to use political either. So I think, again, it's just having your voice be heard. Right. Is that in your town hall? Is that with a selectman? Is that with a congressman, a senator? So it could start on a very small level, and then, you know, in your community, a state level, but on Capitol Hill. So I want everyone listening to know that Autism Speaks is coming down on Capitol Hill and with our top politicians, but as a parent and a supporter, you can make a difference right in your own community and town. Absolutely. And it's letting people know and be aware. And we keep kind of going back to the aware and education. But with that will bring advocacy and changes on a federal and legal level, right, where that insurance will cover all, not private or public. It will cover a higher percentage. It will get those dollars down for families out of pocket every year. Mm-hmm. But it starts with our voice being heard, and that everything everyone's doing to support and talk about and make aware and light up blue is going to make a difference on a higher level. Right. And with all of us speaking that loud voice, change will happen federally. Yeah. So we're getting there. But,
I agree.
You know.
I agree. And I think, you know, again, going back to my personal experience, once my son was diagnosed, in that kind of haze of that period of time, I very quickly realized that the people who could best affect change for us didn't know anything about autism. They may have heard the word, but they didn't understand how it impacted families. And I think your point about making a difference is so important. You can make a difference by using your voice on a small scale, on a big scale, but your voice is important and you have to use it, because the people who can change this and help us will not understand what it's like unless we speak up. And advocacy is a very scary word, but if you're a parent out there who's struggling with this, I, for one, am happy to help. I think you can invite your town officials to your home for a cup of coffee. Ask them to meet you somewhere for a cup of coffee, just to explain what your life with autism is like. And I think that is a very powerful thing to do.
It's very powerful. And that voice can be heard on that small level, you know, at a coffee shop or in your home, but then those officials can bring it up, and the power of all of that will change.
Absolutely.
You know, and it will make a difference.
Absolutely, I agree with that. And again, that offer to my fellow community members, my offer of support stands as well. I think, just getting back to the numbers for a minute, when I heard the potential for these numbers to go to 1 in 50, It's shocking, it's alarming, but it's not surprising. Barely a day goes by that I don't hear from a newly diagnosed family somewhere in this country, in this state. It's very clear to me that we have a huge epidemic on our hands, and we all need to get on board to help change the future and figure out how to address this problem. So, just in closing today, what do you think it's important for people to take away from Autism Awareness Month, Light It Up Blue?
I think it's important to make people aware. So, again, I don't want to keep repeating the aware and education, but I want to also let people know how important that is. So it's not just wearing blue and saying it's for autism awareness, but it's going that one step further to explain why and educate people properly. And it's about acceptance and to celebrate the great things about all of us that make us all different. And I think it's just getting that voice out there and understanding and realizing how important each supporter and volunteer and our community is on a local level.
And I would echo that as well. And there are events going on around the state for Autism Awareness Month. So if anyone out there would like to be a participant, I think they would be welcomed and encouraged, and we would be very grateful for community-wide support. And again, I am tremendously grateful to my own community for taking the steps to show their support for the many families in Simsbury who are affected by autism and will be affected by autism in the future inevitably. So I want to just reiterate that. Thank you very much for being here.
Thank you for having me.
I enjoyed our conversation. I hope I didn't talk too much. As I said, I could be here all day talking about autism, but thank you for what you do, and thank you for coming to Simsbury to talk about all of this with me.
Well, thank you for having me, and you're a great resource and a great advocate as well. So glad to be here.
Thank you. And thank you all for joining us here today. If you are so inclined to wear blue for Autism Awareness Month, please do, and show your support for others in the community. If you are looking for resources, please visit the website www.autismspeaks.org. And again, I will certainly help anyone who is looking for support in our community. Thank you so much for joining me here on the Simsbury Woman. We'll see you again next month.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.